Intracanal unsettlements. Classification of intracanal unsettlement. They are divided into six groups. Group 1, manually operating unsettlement, such as barbed approach and K-type and H-type unsettlement. Group 2, low-speed unsettlement with a leash-type attachment. Typically, unsettlement in this group are gate-gradient, bears, and piezo reamers. They are typically used in the coronal part of the canal and never used in the canal curvatures. Group 3, engine driver nickel titanium rotary instrument. They consist of rotating blades that can safely be operating in and adapt itself to curved root canals. Most engine driving instruments available today belong to this group. Group 4, engine driving instruments that adapt themselves three-dimensionally to the shape of the root canal, like other nickel titanium instruments. They adapt to the shape of the root canal longitudinally, but additionally, they adapt also to the cross section of the root canal. There is currently only one instrument in this group, the self-adjusting file. Group 4, engine-driven reciprocating instruments. Number 6, Group 6, ultrasonic instrument. Group 1, manually operating instrument. Barbed approach. They were the earliest endodontic instruments used to extirpate the pulp. They are manufactured by hacking a round tapered wire with a blade to form sharp projecting barbs that cut or snag tissue. A barbed approach does not cut or machine dentine. This instrument is most used to engage and remove soft tissue from the canal. It is an excellent tool for removing cotton or paper points that are accidentally becomes engaged in the root canal. The K-file and K-reamer are the oldest useful instruments for cutting and machining dentine. They are made from stainless steel wire that is ground to tapered square or triangular cross section, and then twisted to create either a file or a reamer. A file has more flues per length unit than the reamer K-type instrument. The K-type instruments are useful in penetrating and engaging root canals. The instrument works primarily by compression and release destruction of the dentine surrounding the canal. Generally, reaming motion causes a less transportation than filing motion. Transportation is the excess loss of dentine from the outer wall of the curved canal in the apical segment. As the instrument increases in width, its flexibility is decreased. K-flex file. It has a cross section that is rhomboid in shape. It is a twisted instrument and has series of cutting flutes. It has two acute edges and two obtuse edges. The acute angle cuts in the dentine, while the obtuse angle provides more area for debris collection and removal. The cutting efficiency and flexibility is greater than the K-type file. Flex or file. This instrument resembles the K-type file, but it is triangular in a cross section. There is better cutting action and more room for the debris, better flexibility and more resistant to fracture. The tip of the instrument is non-cutting, so no apical ledge formation is possible. Flex R file. The design of the tip of this instrument eliminates the possibility of ledge formation, by removing the cutting surface of the tip leading edge. This guides the instrument in the canal rather than cut. It has a triangular cross section which increases its flexibility. It cuts more efficiently in anti-clockwise motion and can be used for filing action. H-type instrument. An H-type instrument has a spiral edges arranged to allow cutting only during a pulling stroke. An example is hairstone file. An H-type instrument is better for cutting than K-type instrument because it has a more positive rake angle and a blade with a cutting rather than scraping angle. Bending a hairstone file results in points of greater stress concentration that occur with a K-type instrument. These concentration points can lead to the propagation of the crack and fatigue failure. All H-type instruments are ground from a tapered plank. Hairstone files are formed by grinding a single continuous flux. S-file. This instrument is a ground S-shaped cross-section instrument. This is stiffer than the hairstone file. The cutting mode may be with a filing or reaming action. Traditional instruments modification. Number 1. Nickel titanium file. Files made from nickel titanium show great elastic flexibility and resistant to torsional fracture than stainless steel. This file has non-cutting tip and it tends to maintain the curvature of the root canal. Number 2. Golden mediums. These instruments are series of intermediate size instruments. They correspond in size to the halfway between standard ISO size and correspond to 12, 17, 22, 27, 32, and 37 in number. Number 3. Canal Master U. This hand instrument is used to prepare the apical third of the canal. It has a non-cutting pilot tip, 1 mm length cutting plates, and narrow parallel side shafts. It is used to allow for better cutting with a more space for debris accumulation and further removal. It reduces the possibility of ridge or transportation. Group 2. Low-speed rotary instruments. Many types of rotary instruments are used during endodontic procedures, in addition to conventional bears. Bears with extended shanks for low-speed contra-angle handpiece are useful for providing good visibility during deep preparation of the pulp chamber. This is particularly important when using an operating microscope when performing such a procedure after access to the pulp chamber has been achieved. Straight line access to the initial point of curvature can be accomplished using rotary instruments such as gate gradient and bears and piezo instrument. Use of these instruments should be limited to the straight portion of the canal preparation. The risk of perforation with these instruments is a possibility. The risk of lateral canal results in perforation in the lower with a gate gradient bears than with a piezo drill. The piezo reamer is used mostly for post-space preparation. Components of a file. Number 1. The taper. It is expressed as the amount of file diameter increase each millimeter along its working surface from the tip to the file handle. For example, a size universal 225 file with a universal 0.02 taper will have 0.27 millimeters diameter 1 millimeter from the tip. A 0.29 millimeter diameter 2 millimeter from the tip and 0.31 millimeter diameter 3 mm from the tip. Some manufacturers express the taper in the term of percent. For example, Universal 0.02 taper is a 2% taper. Number 2, the flutes or the file. It is the groove in working surface used to collect soft tissue and dentine chips removed from the wall of the canal. The effectiveness of the flutes depends on its depth, width, configuration, and surface finish. Number 3, helix angle. It is the angle the cutting edge forms with the long axis of the file. It gathers debris collected in the flutes from the canal. This angle is important for determining which file techniques to be used. Number 4, rake angle. If a file is sectioned perpendicular to its long axis, the rake angle is the angle formed by leading edge and the radius of the file. If the angle formed by the leading edge and the surface to be cut is obtuse, the rake angle is said to be positive or cutting. If the angle formed by leading edge and the surface to be cut is acute, the rake angle is said to be negative or scraping. Number 5. The pitch of the file. The pitch of file is the distance between the point on the leading edge and the corresponding point on the adjacent leading edge. The smaller the pitch or the shorter the distance between corresponding points, the more spirals the file has, and the greater the helix angle. Thank you for your nice listening. And if you have any question, you can ask in our classroom in internet. Thank you.